Hi, everyone. I'm Holly Miller. Thanks for joining us today and hopefully the other insightful conversations we'll be having this week. I founded Gray Matter almost 20 years ago now after seeing too many breakthrough products struggle to find market traction because most CEOs and commercial leaders fall into the same trap. They think that a product that's superior plus having a sales team and being ready to launch in the market equals launch success. But that's actually what I call the product adoption lie. Instead, we offer companies the blueprint to make your product the only choice the market is wired to want. It's called healthcare category design. It's the strategy behind companies that set the new bar for care and create outsized financial results. We need more innovation to become standards of care, not cautionary tales. That's what makes this conversation today so important. Richard, you have a strong track record, as we've been talking about, of building companies that deliver operational results while also building significant value over the long term. And over the years, we've had several great conversations about how leaders are juggling, if you will, with how, on one hand, to satisfy the quarterly demands of investors while also building meaningful and lasting innovation. So we're excited to have you here today to talk about the power of being different, not better. So let's start with the realities that many leaders face, as I mentioned, which is the pressure to hit quarterly targets while also trying to build something enduring. Most companies in the life sciences space, it's a marathon, right? Not a sprint. And so how do you take all the investment and the time to create something that's really going to have a material impact? And how do you do that when you have your short-term revenue pressures that are really kind of competing against that long-term category creation?
In answer to your question, I think it can really depend on the stage of the company. So if you're running a publicly traded company, there's a intense pressure to deliver on quarterly results, make sure that your revenue is coming in strong. You're gonna be hammered in the marketplace, than on the stock market if you're not delivering returns that investors expect. And the pressures are going to be a lot different at a early stage company. There are different pressures, and you're going to strike that balance differently at different stage companies. I think what's common across all companies is that you need to be thinking about some breakthrough and some category leadership somewhere in your portfolio. So if you're a large company, you've had some initial success, you're managing a portfolio, some level of investment within that overall portfolio needs to be towards category leadership and something that's going to sustain long-term value. Certainly, there's going to be more pressure for short-term, more incremental innovation at the existing product lines to retain leadership. And that's also important. And I think we may be talking later in this session about how as you've attained category leadership, those needs evolve. And in order to stay current and to continue to be a leader, you've got to continue to innovate. But I think most successful companies take a portfolio approach where smaller companies can have a smaller portfolio. Maybe they've got just one product, one big win that they're aiming for. That, like I said, in order to attract investment dollars, that's got to be a significant innovation that aims towards category leadership. And a larger company, sure, they're going to have more pressure on revenue, but they've got to be investing something towards some category leadership for sustained value.
That's great. And I think, someone was talking to me the other day, and a VC company, and they said, what they've come to realize is innovation isn't actually the problem. Like, there's plenty of innovation, there's plenty of technology. That's not the really limiting factor. To your point, though, in order to really create that category leadership, you can't just make it all about the product. You have to really understand what's driving adoption. And it's not so much what you make, but what you make happen for your customers. And I think that that's a very interesting perspective of you can either, kind of play the shorter term win, or you can really be intentional and make sure you have that internal alignment to ensure that you're really trying to identify those unmet needs in the market that, if you could solve them, would have transformational outcomes, not just incremental improvements. And that's what really drives that long-term valuation and also impact to evolving a standard of care. So I appreciate the fact that it's easier said than done in some cases, especially when you're trying to balance the two sides of the equation.
Yeah, but ultimately, it may pay off a lot more to build long-term value than to go for a quick win. And, the same innovation can be framed in different ways by the company. It's the company's responsibility to be sure that it's framed properly so that it's really resonating and it's unique and it stands in a category by itself, positioning it as, hey, we're a little better and we're going to come in with the same sales force, uh, same perceived indication, same competitors, and we're going to be a little better.
I love that perspective. I always say, position yourself or be positioned. You have to teach your market what your value is, what you're solving. Otherwise, they may just put you into a category of being slightly better than something else. On that note, that's a good segue to my next question, which is how do you distinguish between product improvement that kind of is keeping the lights on versus one that actually shifts the competitive landscape so you become the only one that matters and makes the competition irrelevant?
But, for a lot of times, the holy grail in medtech startups is you want your innovation to eventually become standard of care. So that's when, boy, at the extreme example, if it becomes the liability for someone not to use your product because, hey, there's a standard of care out there for this patient that wasn't used, therefore you're at risk. That's again, from a business standpoint, that's a nice position to be in. The definition of a category leader is something that holds that position in the customer's mind, and that's something that's really important to keep in mind. It's not the company that determines that; it's ultimately the perception of the customer. So the company has a hand in shaping that and framing it and making sure that the customer is perceiving, this category of patient or for this indication, this is the only device I'm going to use. This is the only product. This is the only system that I'm going to use. Here's an example. Really early in my career, I worked for Nelcor, which was the first company to successfully commercialize pulse oximetry. And at the time, there really was nothing like it. So, and by the way, there were some legal implications there. There were, for anesthesiologists, which is really where the first place where it was simply safer to monitor a patient under general anesthesia. And I think I was told that for the first time in history, malpractice insurance premium actually dropped for anesthesiologists with the advent of this technology. That's a great example of category dominance.
It's funny to your point, those some of those crazy ideas that do become adopted into the standard of care, they actually seem really radical at the time. My first kind of foray into the medical device space was in surgical robotics, and at the time, the surgeon he was not scrubbed in. He sat next to the patient at a console, and that was crazy. But that's not crazy now. It's totally normal. So it just kind of goes back to this idea of once things really transition and you become that standard of care, it seems so natural. To your point, it would be wrong not to, to do the right thing for patients. And then I think it's a challenge of the category designer is to really try to introduce the concept of like, it doesn't have to be this way. There's a different way to do it. And I think to your point, it does take time, but once that kind of tipping point hits, those category creations really do have a material impact on patient care, physician abilities, lowering cost of care. And I think there's just so many opportunities these days to do that versus just taking making a tiny tweak to have an excuse for the sales rep to, to call on their customers and try to maybe get, eke out a few more orders before the quarter closes. So I appreciate your context, your own personal
Absolutely.
experience in that as well. Um, let's talk for a minute about companies that maybe have, breaking away from the pack, not by being better, but really by being different. Have you seen an example where creating a new category, not just a better product, led to outsized growth or impact?
So the Nelcor example I just used is one example of that. A more recent and just astounding outcome was the latest, the development of Shockwave, the development of intravascular lithotripsy, and talk about a massive value creation. If you look, their acquisition by J&J, I think was around $13 billion. So I think by any metric, if you're going to talk about outsized valuation, if you look at it as a you know, uh, price to earnings or price to sales or, price to EBITDA, they knocked it out of the park. So there is J&J and Acquire, valuing this particular category leadership and on metrics much higher than anything else you'd find in medtech. So they did a fantastic job of maybe taking an area, and again, this is a common pattern you'll see in medtech, where calcified lesions, oftentimes a physician or a customer might even minimize the problem at first before there's a solution. In other words, yeah, I'm uh, interventional cardiologist. I'm treating my patients as best I can. There is this one category of patient where, hey, the solutions aren't great, but it's rare, and um, the patients are doing okay, and there is a standard of care there. And it takes an innovator and a category creator to come and say, hey, wait a minute, those patients are getting terrible outcomes. There's a much better way of doing this, and really highlighting the problem, and rather and kind of fighting that human tendency to minimize the problem when you can't do much about it, to say, hey, this is a major problem. We're doing something about it. So even before that solution gets all the way there technically in the market, but you want to set the stage, you want to frame it so that when you do arrive with your innovation, there's no one else like you out there. And so Shockwave has owned that category for now. I know there are a lot of competitors now developing competing technologies, so there will always be followers when a new category is created. But they've enjoyed and continue to enjoy category dominance in that area. So that's a much more recent example of someone who's been really successful at category leadership.
I love that example you gave, a Shockwave, because I think a lot of times people think, oh, to be a category creator and deliver those outside results, I have to create something not new that no one's ever seen before. They actually took old technology, which was used for kidneys, right? Kidney stones, and then kind of applied it to a different problem and created, to your point, kind of redefined the way care is done now for those patients, and obviously led to a very, high ticket value acquisition. But I think sometimes people don't recognize that you can be a category designer in many different ways. You can invent a brand new category like surgical robotics you talked about a second ago. Shockwave redesigned, they solved a different problem. They niched down existing technology, new application. And
Mm,
then you have the third alternative, which is really category redesign. And an older example might be St.
mm,
Jude Medical. They basically redesigned what a heart valve
mm,
was. They changed the material to solve a problem. Similarly with smartphones, Apple didn't invent the
mm.
smartphone, right? They came around and redesigned what it is. And so there's really three different approaches to category design that companies can take. Um, One of the interesting themes that came up in some research we did and published earlier this year in our State of the Life Sciences C-Suite report was that companies that think they're bringing true innovation to the market, they are finding more often than not more of an anemic uptake. And by their own admission, they say our customers don't get it. They don't understand, our value. And so I'm curious, in your mind, why do you think so many companies struggle to convey the real value of their innovation to the market or to their target audience?
But I think this is a great point. And it's a huge issue for med tech companies. Because whether it's a project within a bigger company or the entire reason for being for a smaller company, this when you're working on a problem and you've got what you think is a great innovative solution, it can seem obvious internally. Um, you know, uh, Take a typical startup with maybe a doctor and an engineer working on something. Both of them think they're working on the same problem. They might actually have different conceptions. They may never have actually sat down and talked through exactly what is the messaging around this? How do other doctors share our opinion? Oftentimes it is something that just seems so obvious to the founders when you actually get them in a room with the concerted effort of, hey, we need now to build messaging around this. We need to frame the problem. We need to figure out how we're going to present this to doctors or whoever the customer is. it's not a trivial exercise by any stretch. Coming up with clear, succinct, punchy language and framing that resonates with the customer, so that they immediately see it. And I've seen this time and time again. Taking some innovation that you think is, wow, this is solving a massive problem, isn't it? But yeah, well, maybe that's an issue, but not so much for me. Maybe for other people, or it's really, it's really rare. As I described earlier, there's a tendency to minimize a problem if you don't have any great solutions for it. So really honing in on um, the doctor every time says, yes, okay, I get it. For every patient like this in this category. And again, patient selection is so critical to the success of any med tech device. But when I have this patient, I get it. I've connected the dots. I know that I'm going to reach for your product every time I have this type of patient. Getting some sort of inroad, getting some sort of yes, and this is something we've talked about with sales forces as well, is you don't want to come up in front of a customer for the first time, have your whiz bang new device and have them say, yeah, no, I'm not really interested. You need to find a way where you've defined the category and the solution is obviously yours and nobody else's. Even if that's a small segment of the overall market, you can always expand from there. But you need someone to connect the dots and say, yeah, I understand this category exists. I understand I need to take it seriously and understand that you've got the solution for it.
It almost seems like the onus is on the company to educate the market. You have this problem. You may not think that it's a problem because you just accept it as the way it is, right? That's just how it is. That's the constraint we have. That's the realities of this patient population, this procedure, this, technology, what have you. And you have to really then take the burden upon yourself to teach them and say, to your point, when you see this patient, this is your heartache. This is your pain point. This is what keeps you up at night. We are now solving that and teaching them to identify that patient or
Yeah.
that scenario, teaching them that this is the right tool or right
Yeah.
solution. Otherwise, they're just left assuming or making their own assumptions, right, of what the value of your product is. And I think the other interesting thing we've seen, time and time again is maybe someone did try to solve that problem previously, but it was successful. I call it like the
Yeah.
hangover effect. It's this idea and like, oh, but I'm not like that. I'm
Yeah.
I'm different. Put me in that bucket. And I'm
Right.
curious if you've seen that as well.
Oh, absolutely. I've faced that in my career where you know, other people generally, if there's some deep problem, other people haven't noticed it before, even if they haven't developed something that's become standard of care, even if the standard of care is still woefully inadequate, but there may have been interest. There's usually been some interest in the past, and it didn't work. So you're now coming for, another try at this space, and it's very easy to get lumped in with the old products. Oh yeah, no, we've seen devices like this before. We've seen approaches like this before. It didn't really work. The analogy I always draw is, yeah, well, there was a Newton before there was an iPhone, wasn't there? And the Newton wasn't much of a success, but eventually they got it right and figured it out, and were able to market it effectively. So, part of it is the technological development over time, but again, part of it is when you have developed to the point where you're successful, framing it properly and creating some distance between the prior attempts.
Just describing that whole scenario, I think the idea is if you can find an important problem or a meaningful problem that if you could solve that for a specific audience, right? Not for everybody, a specific audience, specific patient, specific, provider,
Mm.
the value of your product does somewhat become obvious to them, right? They'll be nodding their head. They'll recognize, yeah, this sounds amazing. And I think that's really how you stop competing in a crowded market and start commanding a category the market didn't even know they needed because sometimes recognize that it's,
Mhm. Right.
feasible, viable because they just kind of, again, heads down, this is the world we live
Mhm.
in. And I'm doing the best I can. And I do think it's maybe harder than people expect, or maybe takes longer to condition the market to teach them. But once you find that strategic
Mhm.
beachhead, you start to feel that foothold and then the momentum builds. And then eventually you kind of become the category king. Um, and that's an interesting kind of segue to my next question, which is, okay, you've done everything right. You built your category, you become that category king, but that doesn't necessarily guarantee long-term, leadership position in that category. So what's maybe a mistake you've seen companies make that has cost them, their leadership position as a category king?
Well, that's critical because as I mentioned before, when a category is created, there's a leader, it's going to attract attention. It's going to attract entrepreneurship. It's going to attract investment in competing products and followers. And the the mistake that we've seen over and over again is that the category leader um, rests on their laurels a bit. Don't invest enough in understanding the evolving needs because that by definition, when you come up with when you've created a new category, um, pretty much as soon as you launch that product, your own engineers should have, 5 ideas immediately about how to make them better. And when you start getting feedback from the market, that accelerates because in actual usage, again, we're talking about med tech, so your physician customers are gonna think, well, can I try it in this indication here? Or if we just tweaked it a little bit, we could, handle another category of patient over there. So you've got to stay current on the evolving needs of your customers. You've got to invest in continually staying on the forefront of that category. I think the classic example of a company that didn't do that was Johnson and Johnson in the stent world. I mean, um, they both created and lost market leadership in two different kinds of stents: bare metal stents early on, and then drug-eluting stents later on. So and one of the main reasons why was uh, unsuccessful innovation and the lack of sufficient innovation after their initial launch.
Sorry, I think you make a good point too. Once you create a category that people find valuable, you're definitely going to have competitors, right? There are going to be companies going to be wanting to come in and compete and take that share. And I think, J&J on the example you gave was, kind of transitioning from the bare metal stents to the drug-eluting stents. When you're the only game in town, as they were they were actually, I think it was Cordis originally, they were the ones that really brought that drug-eluting stent to market. But once there was competition and they were evolving the category, to your point, other competitors were evolving that
Mhm.
category, then all of a sudden people have a choice, right? And they're not, they might choose someone else. And I think Cordis went from like 90% market share to virtually nothing, like 40% almost overnight, because they didn't evolve, to your point, evolve based on the customer
Yeah.
needs. The category is not static, reimbursement was changing,
Mhm.
trade technology was improving. And so I think the companies that really have that category strategy mindset of, okay, what
Mhm.
is it going to take to maintain our leadership position? Is it going to level up to, a platform approach? Are we going to overtake an existing, category by reimagining it? Are we going to take our technology and go into a new, disease state? Or even building a new category that complements the one you started with. A lot of technology and categories beget
Mhm.
other categories. AI is a good example. Yeah, everyone's talking about AI, but
Absolutely.
it's this idea of AI is unlocking new opportunities, but also new category problems. So the companies that are using that kind of
Mhm.
strategic lens of category design, I think, are the ones that are always going to be finding ways to be relevant and valuable to their customers, because ultimately that's what people are buying, right?
Mhm.
Value. They're not really, I mean, they're not giving you business because they like you. They're giving you business because they value what
Mhm.
you offer. And that's only, I think, getting more complex as the new healthcare economy is changing, dynamics are changing. And I think it's just a different buying criteria than maybe you saw, pre-COVID.